KAKU 88.5, the voice of Maui. This is Mary Margaret Baker, NP, with the Nurse Practitioner Show on health, wellness, and managing your dis-ease. Today, with me, I have a very special guest. It's Mary Smithson-Hutto, who has multiple roles and titles, but the one we're talking about today mainly is her physical therapy practice and dealing with pain. I think there's so much pain. I'm not talking about psychic pain. I'm talking about physical pain. And so Mary and I are going to discuss the origins. First of all, a little bit about her background, and then we're going to talk about her 30-year practice here in Maui and some of the combinations of therapies she's done and the program. She has apps on for iPhones to help people take their plan of treatment home and practice. And she also has a podcast. So there's a lot of ways that her patients can monitor and, kind of keep in tune with the treatment plan that she wants them to follow. Anyways, welcome, Mary. We're so glad to have you here today.
Thank you so much.
Tell me a little bit about your background.
Well, I originally started off as a physical education major, so I was heavily into athletics and was a gymnast, and that brought me into injuries. So I always wanted to be an orthopedic surgeon, but knew I didn't have the brains for that. So I got into
Maybe you did.
Maybe
you
I
never
did.
know.
Yeah, I wish I got into that. But so I became an athletic trainer, and I had a great passion for that, and ended up getting, after I got my bachelor's and I went into the sports medicine field and got my master's in sports medicine, but there was no jobs unless you wanted to be a teacher, which I was, and then in the afternoons, get a stipend for doing athletic training. So at that time, sports medicine was barely getting very large in the 80s. So I went back to PT school and got my physical therapy. So after that and being in practice for years, I realized the hands-on component was so important to treating people.
So manipulation, basically?
More massage.
More massage.
Well, there's all these different pieces of the pie, and manipulation is very, very important. I mean, there's exercise, massage, stretching, all these things. Components are all pieces of the healing pie. So yes, but not really manipulation, more massage. So I went back and got my massage license while I was a physical therapist, and my practice pretty much consists of half of the treatment doing hands-on work that I've kind of developed a little, I call it myofascial reposturing, where I combine massage, neuromuscular facilitation, myofascial release, mobilizations, all these different things to create and then the second half of my session is really educating people, because I really am teaching people to get better. And because I feel like if you can't get a handle of what your problem is, how you're going to get better. Everybody wants everybody to get, they want the pill to get them better or the doctor to get them better, but it's you that have to get yourself better. Self-responsibility.
Exactly.
So the stretching is such a major component. And even if I couldn't do the massage work, the stretching is the most important thing. And that's what led to my stretching apps. I started off with a book and went to DVDs, and as technology progressed, I made products for those progressions, and then my final progression is these.
At this point,
are apps.
Well, I was able to get onto your apps on my iPhone, and I looked at several of the different. You have upper body and lower body apps, the two apps, and I found them extremely explanatory. In other words, if I didn't know anything, which I'm not in that situation, but if I were Joe Q Public and you gave me a neck stretch to do, I could go on that app and I could see exactly what I needed to do, because there's verbal and there's visual. And so I thought they were really great. I really applaud you for getting that.
There is so much information on those apps that it's almost overpowering, but I couldn't leave anything out. So I try to set up the app where you could go straight to a section just to get quick relief. But I really want everybody to see all the sections.
Yes.
And some people don't want to do that. Again, they just want to do one stretch. And it's hard because I have like 20 stretches, let's say for the upper body and 20 for the lower body. And it's all the same thing, for each sport. It's not like you're going to have different stretches for each sport. I mean, upper body sports, you're going to do the upper body stretches, and lower body sports, you're going to do lower. So it's kind of a lot of feedback I've gotten is like, well, aren't there more stretches? Well,
not if you do all of these stretches, you're going to be A-okay. Yeah, exactly.
Yeah.
Well, I think one of the things that people don't seem to understand, because there is so much pain, physical pain, that what is the origin, do you think, what has been your practice experience for the origin of pain?
So when I was in PT school, and I can visually remember, it to the second when I asked my professor, what causes low back pain? And she looked at me and she said, we don't know. And I said, how can we have somebody go to the moon, but we cannot tell why we have low back pain? But we do know what causes low back pain, but through financial interests, that's suppressed, because people make money on having pain. So if everybody was out of pain,
where could they bill?
Right.
And what could they bill for?
Right. So my goal, I'm a very analytical thinker. I have to know why. It drives my husband crazy. I'm always, why? Just do it. But no, I got to know why. So I have done a lot of research in my life and through all of my experiences to find out why. So pain, what I feel is muscle pain, and what I have seen in my 30, 40 years, 50 years of experience is that because I started off with athletes, in college, and I see a lot of elderly.
They seem to be very disciplined and dedicated.
Right.
I mean, if they're a college athlete.
Right. But what I see what the difference is in all the years of seeing people's age group is that somebody that's 50 years old, the only difference that they have them from being 30 years old is that they're tighter. So my whole focus is muscle tightening. Muscle pain is muscle tightening.
Shortening of the muscle.
Shortening of the muscle. So what does a muscle do? Well, the primary reason for a muscle's purpose is to move a joint. It crosses the joint to move the joint. So when it shortens, it crushes the joint. So long-term compression on a joint, it damages the joint. It causes bone spurs, or it causes a vertebrae to compress and stuff like that. And then whatever structures are around it or in between it. So meniscus tears, discs between our vertebrae, all these things are caused from compression. So if we can lessen the compression on a joint, we're going to prevent a lot of injuries, and we're going to prevent a lot of damage to that person and the pain. So my goal is to regain everybody's mobility back in their muscles and their joints.
Now, say someone comes in and they have a hip pain. And how would you approach that patient for hip pain in terms of do your assessment, kind of walk us through your assessment, and then where would you go in terms of developing the plan of care from your perspective of treatment? Okay.
So hip pain, the first thing I'm going to do is find out, it's called subjective. You're just asking the person, what's going on, and they'll tell you exactly where it's bothering the pain. And pretty much even just what people tell you right there without even touching them, if they tell you where that pain is, 9 times out of 10, what muscles are being affected. But everybody breaks down the same way. So it's not like every single person's different. Pretty much everybody has the same problem. So it's not that hard to figure it out. But the first thing that I do is ask them what's going on. And then I'm going to do my objective kind of thing. And so I'm looking at range of motion first. That's the very first thing I do. And I want to see where they're tight. Are they tight in their rotators or whatever they're tight in? And then the muscle testing, I'm really not that concerned with, because when you have muscle weakness, there are 2 or 3 different kinds of muscle weakness. One can be atrophy from, let's say, a surgery. It's just sitting there. But most muscle pain is caused from compression from that nerve being pinched or that area.
Shortening of the muscle.
The pain is causing that muscle to be weak. So I'm not even concerned about that and I don't do, strengthening is totally contraindicated on any of my clients until I have full mobility. So a lot of people think you have to strengthen when you have pain or if you have weakness, but you end up making the person worse because you make the muscle tighter than the muscle shorter. So my goal, when I just have the person stretch out, all of a sudden their pain goes away and their strength comes back. So it kind of takes care of that problem. So when I look at them, I'm looking for primarily the range of motion. And after that, I do a treatment with them, and I do, like I said, the massage or the myofascial release, and I do techniques to help gain range of motion while I'm with the client. And when I'm massaging them, I'm getting blood flow into that area so their pain goes down and it's easier to move. So when they go home, it's easier for them to stretch because it's very hard to stretch when you're in pain.
Now, what about compliance? How have you found that to be with your clients, your patients?
Well, the first couple weeks, they're in so much pain that asking them to stretch isn't really happening,
Yeah.
So that's why I do a lot of hands-on work with them, and I kind of it's a technique called PNF, proprioceptive neuromuscular facilitation, so that I can sneak in and get some range of motion on that. So after about a week, their pain starts to really go down. So in about a couple weeks, they start to like the stretches. So pretty much in the 3 to 4 weeks that I have somebody, if I'm lucky to get 8 visits, I've gotten 80% of their pain gone and they're feeling a lot better, and then they can do their home program by themselves.
That sounds like a good approach because it seems very holistic in a sense. You're doing your part. Now, what about machines? A lot of physical therapists have people on machines and cold lasers, all kinds of things like that.
Well, as I was saying earlier about the pieces of the pie,
yes.
I mean, there's no wrong treatment. Everything that's in our arsenal helps. But what we're all trying to get at is circulation. If that's from adjustments to strengthening to stretching to ultrasounds, E-stems, everything, what everybody does is they're trying to get circulation to that area. Because when you get oxygen...
Blood. You're talking about blood circulation.
Blood circulation, which brings in oxygen, and it takes out the toxins, which is causing the pain.
What are the toxins? Lactic acid are
Lactic
the
acid.
toxin you're talking about.
So it takes out that lactic acid, so you feel better. So even people that do strengthening exercises, they'll feel good, for a couple hours because they've gotten blood flow in there, but then they've actually tightened the muscles and they feel worse the next day. So, but the circulation is the most important thing. So when I was a therapist 15 years ago, I could see somebody for a month, sometimes even 2 months.
Like how many times a week?
I used to see people 3 times a week for a month, always. And now 1 to 2 times a week for 2 to 3 weeks. The most visits I'm getting lately are 6 to 8 visits, sometimes only 4.
And this is through Medicare and
all
individual insurances.
It's just terrible. So I'm expected to get somebody better in 4 to 6 visits. So I don't want to waste.
How do you do that?
I don't waste my time on things that are only going to be temporary. I want to do permanent things. So ultrasounds, E-stems, even though they increase circulation, they're just temporary. They're not changing the fascia. They're not gaining mobility. They're not doing anything. So I've really kind of zeroed in my practice. What is the most effective way I can get somebody better in such a short period of time? And I really try to stress my patients, you got to help me. You got to do these things at home. I don't care if it hurts or not. You're not going to hurt yourself stretching. Mm-hmm. You have to stretch.
Stretch. Now, what place does heat and ice play in your treatment plan?
So again, I have a short period of time, and I don't want to waste,
but maybe in their home plan.
In their homes.
Yeah.
So I do put the only machine. Getting back to you with the machines, the only machine I use is intermittent pelvic or intermittent lumbar traction because it helps suck the disc back in. And I have a bad back, and so I use it on myself. So if somebody has a herniated disc or a bulging disc, I can get that material back in. And I see it every day. My machine is awesome. So I do use heat for people that have a neck on the neck traction because it helps them relax while they're getting the traction. So I will use the heat occasionally, but not as a afterthought.
Oh, so as a pre-treatment
or after during, but not taking away what I'm doing.
So at home, use it for what? Relaxing, bringing blood into the muscle while you're then going to stretch it with traction.
Yeah. Exactly.
Okay.
Or at the end of it, if I just want the person to relax after I've tortured them, I have no whining signs all over my office.
Okay.
So I sometimes I'll put some heat on just to let them relax after that before they do their stretches. But at home, I tell people the ice is the most important thing for ice is the first 24 hours.
Yes.
And then after that, it's heat. And I did my master's thesis on this. So I did a master's thesis called Secondary Hypoxic Injury. So when somebody breaks or let's say they sprain their ankle,
which is very common.
right? So you have the primary injury is the tearing of the tissues and all that kind of stuff. But the secondary injury is the most important one that we can change. So if you immediately sprain your ankle and you put ice on it as fast as you can, what you're doing is you're lowering the temperature of the cells around that injury. And so when you're
Muscle cells?
uh,
What cells?
gosh, there's just the whole cells, tissue cells, I guess. Yeah, I guess the tissue cells and everything around it. Because if you can lower the temperature down there, those cells can survive. Because when your body gets injured, the white blood cells rush in to protect the area. And if that area is inflamed, it just keeps putting in more white tissues, and it swells, and it creates this cycle where it causes more tissue destruction, and then it just gets worse and worse and worse, and you get this big swollen area, and then it takes longer to heal it. So if you can get that area really cold, then you're preventing less tissue death.
Okay, because I know when I first became a nurse practitioner, which is over 30 years ago, they always said put heat on. So people got very confused. Should I use heat? Should I use ice? And that the whole modality or the thinking for treatment changed. And so the first 24 hours, yes, ice. Finally, and people would still be in the old thinking, and they'd put on heat, and then it'd make all the swelling, and you know where that goes.
Right.
Longer treatment.
So what I tell people is if something's hot and inflamed, the last thing you want to do is make it more inflamed. So when you wake up in the morning, you're not hot and inflamed, you're stiff. You can't move, so that's when you want to put the heat on. And then in the afternoon, when that area is just pulsating and just throbbing and it's miserable, you want to cool it down. So that's how I try to explain heat in the morning, ice in the evening on a normal pain cycle thing.
Yes. So I think that I would say that your patients are repeat patients because they know. And do they start? How do they respond for additional treatments? In terms of injury, do you have a lot of athletes that are your patients, or what's the patient profile?
I wish I had more athletes and more, because my favorite thing is orthopedics. Because in Colorado, I worked with 3 orthopedic surgeons in their office, in the surgeries with them, and it was a wonderful job. And I did that in the mornings, and then in the afternoons, I ran a sports medicine clinic outside of Boulder. So it was a great time. So I was totally hands-on with that. But here in Maui, I'm kind of tucked away up in Kula, and I used to have a business in Makawao, and I moved it to my home. And so most of my clients are not. They're clients in their 40s, 50s, 60s. So I see a lot of necks, a lot of low backs. I don't see a lot of the orthopedics, but like right now, I'm seeing a lot of my friends, because I'm in my 50s, are getting total knee replacements, and so I've been fortunate to work on them where I hadn't in the past because I didn't know the people. And I go to their home the minute they get off the airplane, and I massage them every single day for about just 15 minutes, just lightly getting the stuff through. And their pain level is so much less, and they're in such less agony because the swelling's down, and I can get the range of motion back really easily, and then they can come to my office. But that first week, I'm like, listen, I'm just going to show up every day for a few minutes, massage it, and the swelling just goes way down, and the pain level's way down, and within a week or so, I got 80% of the range back. So
that's a good result.
Yeah,
that's a great result.
Yeah. So getting back to the way I get patients is through a doctor. I'm not a physical therapist has to have a doctor's
prescription.
Referral.
Okay.
I do have my massage license, so I do have a side practice. If anybody wants to come in and see me cash, I do have my massage license. But primarily my business is with doctor's referral, and I just hope to do a really good job on each client so that they tell their friends. So I don't get a lot of repeat. Unless they, I've been here for 30 years, so I might have seen somebody 10 years ago or 15, and they come back to me. But I try to get that person better, so I don't really see them for the same injury.
Right. I'm thinking
Yeah.
of it. Well, like, for example, you played polo.
Right.
So that may be how you hurt your back.
No, it was
No.
snowboarding.
Snowboarding, my greatest fear. And it was snowboarding in California and having a snowboarder run into me.
Ugh.
The last time I went skiing, I had that happen, and it was like terror.
I hit some blue ice and came right down on my butt and totally compressed my vertebrae and continued to play polo and do the stuff and ignored my pain. And then I took my husband's zip lining, and that was it. Totally herniated my disc with the zip, because you come in onto a platform. And so that was
that was it.
That was it.
Now, in California, physical therapists they don't need a doctor's order to treat.
There's only a few states that allow that, but the way
mostly you need a prescription.
Well, it doesn't even matter because we get paid by insurance companies, and so the insurance companies say we won't pay the physical therapist without a doctor's referral. So even if you do have that
kind of liability or that latitude,
all you're getting is cash patients because the insurance companies want that piece of paper. So
I see. Now, do you do any intrapelvic work?
I do a lot of release around the pelvis, which is very vital, but most people don't like to do that. I do a lot of TMJ stuff on people, and I do a lot of armpit stuff and pelvic stuff, but one of the most important aspects of my work is it's based off of Heller work, which is based off of similar to Rolfing, Heller.
I've been Rolf, so I know what you mean.
So those two went to school together.
Ida Rolf, right?
Yeah. So Ida Rolf and Joseph Heller went to school together, I believe, in Boulder, and so they kind of broke off. So Ida Rolf, I haven't been Rolfed, but it's both of them are wonderful. But from what I understand, the Rolfing is like they don't use lotion, from what I gather. Did they with you?
I don't believe so.
Yeah.
Yeah.
And the Heller work, I learned from the Heller work practitioners up in Seattle, and it was more with lotion, but it's the same theory. You have to start from your core. Every injury your body breaks down because of your tightness in your pelvis, and then everything gets broken out. So the psoas I'm obsessed with the psoas. I'm the authority on the psoas. And the psoas is our hip flexor, and it attaches to your back of your spine and comes through your body. Through your pelvis on each side, and attaches to your thigh, your upper thigh. So it tilts your pelvis forward when it's shortened. So we're trying to get perfect posture as our goal. So if we stand perfectly upright, but then we bend over at the waist, our shoulders come forward, our head comes forward, our pelvis brings us forward, so it's hurting our back. We're off balance, so we're gripping with our toes. All our hip muscles shorten. And so our whole body gets
distorted.
I can't treat your neck if you have a hip flexion contracture. So if somebody comes in with a bad back and a neck, I ask, can we at least work on the back first and then get another referral for the neck? Because I hate to do a referral for the neck and the back for 6 visits, and then I'm basically not spending much time in each. I'd rather them come in and do the pelvis, get that opened up, and then if it's a shoulder or neck problem, work on that. So
now,
that's
if you have different, so when you have a limited number of visits, say you have 8 visits is it just that's all they get for the year, or is it 8 visits per injury, or how does that work?
Well, it used to be, a lot of places have for the year, they'll have a limit. Let's say for HMSA, it's per
injury.
Well, not even per injury. Like if they got a referral for neck and low back, it's for that month. They'll give you 6.
Oh, for a month.
For a month.
Is there a total number of visits that you can?
Well, I've never gotten over 10 ever from HMSA. In consecutive.
Is this with Medicare, with a secondary, or is this HMSA?
HMSA.
Just pure
HMSA.
Okay.
Medicare is probably my best insurance because you can
You
treat
hear
somebody.
that, everybody?
Really, who would ever thought that
Who would have
Medicare
thought Medicare would come through?
Yeah, Medicare has been great because I have a cap. Let's say it's 1,800, but I can see somebody for 8 visits or 10 visits, and then work on a different referral and a different body part and get them healthier than. Because what I have a problem with when I have somebody for 6 visits, there's no way I can take somebody that's had 20, 30 years of problems and get them better in 6 visits. So I get them like 70% better, and I have to wait. So I get another referral, and then I have to wait another month before I can get that referral okayed, and they give me 2 or 4, and it's like they backtrack. So I have a hard time with that insurance and getting people. I'd rather they give me 10 right off, and I can get that person better in 10 than have to
Piece it out,
piece it
piecemeal
out.
it. Yeah.
Yeah.
Well, it's amazing because the insurance industry has changed so much, and it kind of dictates the parameters of treatment, doesn't it?
Oh yeah, the doctors. It doesn't matter what the doctors say. The insurance
Is the
Yeah.
heavy hand.
Mm-hmm.
Yeah.
And the insurance is, they have a nurse or they have somebody in there that dictates, okay, this injury dictates this,
Well, they have a logarithm
uh-huh.
that will, you have this, then it goes there. If you have this, or no, and then it goes over there. So it's not even like an independent nursing judgment, which I think would probably be a better, it's just kind of a protocol that's in writing that they just read.
Right. But I'll get somebody that will have a simple injury and they'll give me 8 visits, and then I'll have somebody who's got this horrible neurological problem. They'll give me 4, and I go, this doesn't make sense. It's very frustrating. I'm more frustrated than I've ever been as a therapist because of it. It's just, can I please do my job? I want to get this person better.
Yeah. I mean, pain, because I think that's one of the reasons, and we don't want to get off on the opioid rampage, but I think people are in so much pain that then they get more pain and get addicted. That's another show for another time, but
Right.
I think that leads to it.
Exactly, because if I can take somebody with a simple neck problem and get them better in 8 to 12 visits, but if I only get the 6 and then they regress back and then they get addicted to their pain meds, and then something that became simple is chronic, and I may never get rid of it because it's because I'm getting that piecemeal. And then once the people are addicted on the pain meds, it's so hard.
And especially like just today, I was reading about fentanyl. When I first used fentanyl, it was as for hospice patients, and I had a home health agency, and so we would have to, or I had a practice, and people were dying, and they needed pain relief, and there was patches, and that's the first time I had personally ever dealt with fentanyl. And you'd have 25 milligrams, and you can add to 50 and go up because it was good. That one patch was good for 3 days, and if it managed their pain. And so, being a home health, we'd have to go in every 3 days, replace the patch, or depending what their condition was. And so, but this is the first time I've read, even though maybe my head's been somewhere, that there's a fentanyl addiction going on. And I'm going, with patches? I mean, how are they getting these things? I don't know.
Well, I mean, in the olden days, I mean, I remember Valium and maybe Vicodin and Percocets, but now everybody's getting oxycodones or Oxycontins, and I was very stupid about this. I did not know that Vicodin and Percocet are synthetic heroin. All of it's heroin. So everything they're giving patients now is a form of heroin. I mean, the only thing that's not heroin is ibuprofen, right?
Or Tylenol.
And Tylenol,
yeah.
which destroys your liver, your kidneys, or all
whatever,
that.
all the above.
So
right.
it's like it's they're just prescribing it like too easily, I guess.
Well, it's hard to know. I've read a lot about it, but this is the first day I actually read an article about fentanyl. So this was a new, interesting twist to the whole saga of addiction. We're going to have a break in a minute, in a few seconds here. And so what we're going to do is we're going to come back, and I'd like to talk a little bit about your apps and the strengthening. Once people have gotten, say, their minimum, maximum treatments, and then what you look forward to in terms of their stretching and their mobility remedy. for the next phase of their own self-care.
Have you or someone you know been diagnosed with cancer? According to American Cancer Society, an average of 19 people a day are diagnosed with cancer in Hawaii. Pacific Cancer Foundation is a nonprofit organization that provides free support services for Maui's cancer community. Visit our website for a list of programs or to make a donation. We are all in this together. Call today, 242-7661, or visit our website, pacificcancerfoundation.org.
Listen, my life changed because someone was there to get me to use drugs. No one can understand. People think that having someone who will listen makes it better. I need help.
I'm listening.
I need help. I think that having someone who will listen makes it better. People understand. No one can get me to use drugs. My life changed because someone was there to listen.
Go to heretolisten.com for tips and tools to turn addiction around. Brought to you by the Ad Council.
What up, Maui? I'm Suzanne Kayan, your host of the Maui Zan Show here on KAKU 88.5 FM, the voice of Maui. Please join me and my incredible guests every Wednesday at 2 p.m. for fun and informative conversation. Sexuality, family, pop culture, music, social causes. We talk about it all with a fresh and forward-thinking twist. The Maui Zan Show, 88.5 FM, the voice of Maui, trying to evolve.
KAKU would like to thank the underwriters and sponsors that make the Voice of Maui possible.
Doorway into Light is a nonprofit organization on Maui. We operate Hawaii's only nonprofit funeral home and its only certified green funeral home. Since 2006, Doorway into Light has been supporting the dying and their families and offering community presentations and workshops throughout Hawaii and the mainland.
Please support the businesses that, through their generous donations, empower free speech in the Maui community.
Welcome back to our show, Mary Margaret Baker, NP, the Nurse Practitioner Show. With me today, I have Mary Smithson-Hutto. That's an unusual name, Hutto. And we've been talking about pain and remedy, how to use physical therapy, what her approach is, which is pretty much hands-on, I would say, as opposed to machines and what have you, which some therapists have to rely on because of, as we were talking about, insurance reimbursement and trying to use the maximum use of your insurance benefit, and it doesn't always get to the remedy, I'd say. Wouldn't you, Mary?
Well, I think what makes Maui different and why I'm able to do what I do are two things. One, the doctors of Maui are really wonderful, and they let the physical therapists have
maximum.
They let them use their expertise. So I know in the mainland, a lot of my therapist friends, they get a script. You got to do ultrasound, hot pack. You got to do what the doctors say. So, but here in Maui, I think the doctors have been, a eval and treat is what I get, and then they let me figure out what's going on. And I think it's a lot easier to call the doctors here than it would be in the mainland. So that's the one thing. But also, I think it also is economic too. Like when I was I had an office in Makawao, and I had a huge staff, and I had all the massage therapists and physical therapists, and you have to pay everybody, health insurance, and it's a very costly thing. So even though I still did the same kind of stuff that I do now, maybe as I did then, it was just a bigger scale. But most physical therapists, if they're working for a clinic, they got to pay all the fees and stuff, so they can't see just a one-on-one person. They can't spend 1 hour with somebody like I do, and so they have to see more people through, and it's a lot easier. Frankly, what I do is hard work. I mean, it's hard on my body, and I'm getting older, and it's it'd be a lot easier just to tell somebody go on a mat table and do their exercises. So, and they can run a lot of people through more, in an
Trying
hour.
to cover the overhead, of
Cover
course.
the overhead. So I work
Yeah.
out of my home, and so I don't have that huge overhead. So that gives me the affordability of being more of a healer than I would be a technician.
Technician.
Yeah.
Well, it also, I mean, if your body is not, let's say, finely tuned and you're not stretched, then that kind of leads to premature aging of your body.
Correct. That's what causes premature aging.
Is the non-compliance of the stretching and keeping your
If I
body.
could do another thesis, I have 3 degrees. If I could go back to school, my mother would roll over in her grave. But if I could go back to school and do another thesis, my thesis would be if I could do an MRI on yoga instructors, yoga and their backs at certain ages, 40, 50, 60, whatever, and then do regular people and just see the comparison of people that have stretched their whole life versus people that haven't, and show the degeneration differences. I think my hypothesis would definitely be, if you've stayed limber, you're not going to have these degenerating discs.
Well, the other thing is people's they look younger. If you've done stretching, if the entryway was the yoga, or however, whatever you used as your entryway into doing the stretching, maybe just doing stretching, what I found is that people just look younger because they're not in dis-ease. Their bodies are not in dis-ease. And so they don't have as many wrinkles. They just look younger, even though there's maybe 60, 70 or older.
So, like I was saying earlier, my whole focus is to get the mobility back in each joint. And the reason why I'm doing that is because I'm trying to get back to proper posture. And when you do not have proper posture, you cause disease. Because when you're bent over at the waist, you're not getting a full breath. You're not getting the diaphragm opening up. You're not getting the oxygen, and all that carbon dioxide and lactic acid all stays in your body, and you get sicker and sicker. So just that whole the breathing and your organs being compressed and your joints breaking down, and you start, at 6 feet tall, and you end up when you're 80, being 5'6" because you're all shriveled over.
Right.
So that whole breaking down. So my goal with people is to get that proper posture. When they're sitting at their desks all day, I want them to have it where they're not pushing their discs out and they're not holding their head up with slouched shoulders. And so on my neck app, I have a full section just in how to set up your workplace and your computer screens, and if you got a laptop, what to do to modify that. All these things. I spend a lot of time, like I told you, educating my clients, and we sit down. Okay, what is your job? Okay, well, how can we help? So we're not, if you think of their injury as a wound, and I rub that wound all day, that wound's going to get bigger. You're never going to get better. So we're trying to minimize that scarring, that wound.
Yeah.
So I spend a lot of time trying to find out, okay, what do we have to put in your shoes to get your alignment right, so you're not putting all the stress on your knees from your ankle arch falling, and how do we get rid of your hip flexion contracture so your shoulders aren't rounded, so you're not pinching your rotator cuff and damaging your neck discs, and things like that. So we're problem solving. You're treating the cause, not the symptom. And when you do the machines and modalities, if you're just chasing the pain, you're never going to get the person better. You got to say, what is causing that pain, and that's my whole focus.
The root cause is what you're talking about. Well, stretching, I remember when we spoke earlier, you talked about stretching as the missing link. And again, it comes back to the cause. And on your app for upper body, I did notice that you had a section for at the desk. And so many people, even therapists I know back on the mainland, they end up with low back problem. And so low back, I don't know, it's a very pervasive problem. And I'm sure you are seeing a lot of low back issues.
Correct. Yes, that's the primary problem with most people. And that all stems back from the psoas muscle that I was telling you about. I feel, and this is just me, but this is my little thing, I feel that every injury that I see is somehow stemmed back to the psoas. Shortening of that hip flexor muscle. We sit all the time. And it isn't just people that are older that have a contracture in the hip. I see 8-year-olds with it, because our society, we're sitting all the time. We sleep in a slouched, all curled up position. Then we get up and we go sit and have breakfast in a sitting position. Then we go and get in our car and we sit in a
Sit.
sitting position, or we go to school and during the sitting position and we sit there for hours and hours and hours, not exercising anymore. And then we come home and we sit and we watch TV and we sit and then we go to sleep. And so this contracture happens. And I mean, I was blown away. Like 8 years ago, I knew this boy who had a meniscus tear in his knee, and he was 12 years old, and I had never seen anybody under 30 ever. And meniscus is the cartilage between your bones and your knee, and when your hip muscles, mostly all knee problems are due to tight hips, except like if you got hit in football, but
Or
pretty
skiing.
much. Well, yeah, but pretty much all injuries and all pain in the knee is due to tight hips, because these hip muscles come over the knee, so they squish the knee and they squish the hips. So you have this compression pushing the knees together, and then you pivot and you tear the meniscus. It's like squishing a donut and then ripping the donut. So that person, when somebody has a meniscus tear, the surgeon goes in and takes out the piece of meniscus
Shaves
that's
it.
torn. But you still have the compression there. So in a month or 2 or 6 months, you're going to tear it again, and you're not getting at the cause.
Right. So what would you, for low back, how do you approach that in terms of your treatment plan?
Okay, so
And maybe it's similar to what we've already talked about of the upper body, but
so the psoas. So I
psoas.
go straight for the psoas. I'm not shy.
okay.
I go straight in and I massage it, get some blood flow in there. So when they do, I teach them a specific stretch called the lunge stretch, which is in my apps, and I have it all over my website and things like that. And it's very hard to get at the psoas because you have to kind of localize it. So I have modifications of doing the psoas if somebody just had a knee surgery and they can't go on their knee, or they're really elderly and they can't. But pretty much, I've had 90-year-olds get on the floor and do the psoas stretch. So it's all in people's brains because, like I said, the hip muscles shorten because of the psoas being tilted forward. And so the quadricep gets shortened and it crushes the kneecap into the joint. So nobody likes to kneel on their knees when they get older because the muscles are so tight.
Mm-hmm.
But you have to kneel on the knee to stretch the psoas. So I just please just trust me, do the stretch, and in a week or 2, it's not going to bother you. Put more pillows under your knee or whatever.
On the floor.
Yeah. So I may not get them to do the psoas stretch the first week or 2. I may just work totally on stretching, massaging, teaching them other stretches to try to kind of open up the hips a little bit more, the ITBs and all different muscles. And then I try to get them
IT band, it's ITB.
Yeah, the iliotibial band,
Yeah.
which is on the side of your thigh.
Right.
And that gets tight from your psoas being shortened because it tilts the pelvis forward, and that it's always in a shortened state, and that pulls your kneecaps out, and you get the knee problems.
Yeah. And then you what I have seen is that you have gait disturbance because of all the shortening, so you may have some limping, and that feeds into the whole shortening. I mean, it's just a totally madness.
So the psoas externally rotates your leg. I mean, there's a reason every single muscle when it shortens does something weird to your body. It's it's the same thing with each person. It's nothing new. And so when you have a hip flexion contracture, your leg externally rotates. So when you do a heel strike, when in a normal gait, it's supposed to be heel, ball of the foot, and then off. But when you have an externally rotated leg, it goes heel arch off the big toe. And then people wonder why they get bunions and fallen arches and, all
the above.
but also inner knee pain.
Oh, yes, the medial aspect, right?
Because you got all the stress on there, and they get the swelling, and so it's really important. Every single person should have an arch support in their shoes.
Mm-hmm.
Even people with high arches,
if you fall in,
but just that force of coming down and there's nothing there, arch supports are very, very important, and people to get their position of their legs proper
Correct.
for walking.
Now, is there a podiatrist you work with, or several here on the island?
No, I don't, because I'd like to, but I have a hard time with people getting prostheses with their or prosthetics that shape them into what they're already at, which is wrong. Like somebody has a shortened calf muscle, they give them a heel lift so they don't get calf pain, but then they always have a shortened calf muscle. So I like to get at the cause and get rid of that problem. And then just to me, the most important thing is stretching out the muscles that you walk normally again,
I see. Okay, well
and then use the arch support
to maintain what you've already stretched out.
right. And
Now-
some of the doctors, refer to me, and they try to work with me, and then whatever resulting after that, if they have a shorter leg or things like that, then you
Yeah.
can get those, because they're expensive.
Yeah. Oh, it's about $300, I
Yeah.
think, to get an.
And then you got to keep changing them as you get better. So
Oh.
let's get rid of the problems, and then we figure out.
Then you figure it out. We still have some time, but I want to make sure we mention you have a website, and what is that?
So it's called stretchawaymusclepain.com.
Okay, stretchawaymusclepain.com
Correct.
is your website that will give people information.
So it's just kind of, it just leads you off to different areas, because I do a lot of different things. I sell my 2 apps, so you'll see my little icons, and you press on the icon, and it will take you to the iTunes store. And I only have them on for iPhone or iPad because of my apps are so unique. They're animated apps,
They are,
and
yes.
they're beautiful, and
Gorgeous.
it
They're,
took a
I
long
really
time and,
enjoyed looking at them.
to get these things right. And I just didn't want it just to have some people stretching. I really wanted it to be nice. And the apps, so Android has a lot hard time with people
Animated.
No, people stealing the subject matter and things like that. It's not
boy.
secure. So Apple's secure. So that's why we've always stayed with Apple. And pretty
That's
much
interesting.
everybody either has an iPhone now, or they have a relative that does. So if you don't have an iPhone or iPad, you can
Yes.
have your spouse or your friend or whatever have it, and they can download my apps, and you can look at them. Kind of thing.
and use it.
Yeah.
Yeah. And the other thing is, which I didn't know, you have podcasts.
Yes. So I really like the podcasts. I really enjoy doing them, and I've taken a little break right now because I've been moving this spring. My son's going to college, and so I haven't been able to focus.
Oh, an empty nester you're going to
nest.
be.
Well, not totally empty nester, but it's getting smaller.
Yeah.
But so the last 5 months I haven't been able to dedicate, but I put out about 20 episodes, and they were pretty much covered a lot of my major issues. So I think after that, I was hoping to get feedback from people that watch my podcast to give me ideas of things they wanted me to talk more on. So I'm
Yeah.
hoping to get that
Now,
feedback.
where would they find that podcast?
So if anybody, that you don't have to have an Apple or iPhone phone, anybody can download iTunes onto their computer. You don't have to be an Apple user. And then on iTunes, my podcast is called Physical Therapy Secrets.
Physical Therapy Secrets.
Correct.
And you'd go into iTunes.
Right. So you go to iTunes and you go to the podcast section.
Uh-huh.
And if you type in neck pain, back pain, pretty much I've covered everything on there. You will see my little Physical Therapy Secrets icon somewhere on there, and then you just click on it and you can see my episode.
Oh, that sounds great. So you've really dedicated a lot of energy, time, and money to providing people with wonderful tools to support their healing and eradication of pain.
Well, I've had to, because healthcare's changed so much that a lot of people can't even go see a physical therapist anymore. They can't afford the co-pays, or the insurance companies won't let them go see. They'll take them months before the doctor will say, okay, now you can go to a physical therapist. And so people have no tools.
Or it goes too long, and then it's like you said, it gets into a chronic state,
Right.
and then you have
They
double
want-
trouble,
Right.
basically.
And they want to wait till it's chronic before you see a physical therapist. I'd rather get somebody soon to get rid of it, and then it never gets that far.
Now, you mentioned also that you do massage. You're a licensed massage therapist.
Mhm.
How much do you charge?
$60 a visit.
60 a
I
visit.
try to
which-
make it
reasonable. That's a very reasonable amount. And normally, do people just come for an hour and a half?
I
Or how do you-
can't do an hour and a half because I'm also
too
a physical
much.
therapist. I can
Oh.
only, my poor body, I can't do more than an hour. But I don't think I do total 60 minutes massage, but I do a lot of it. And then I'm also kind of giving my advice on stretches and why they're, try to give the person the reason why they're having problem too. So it's almost kind of like a little physical therapy thing, but
A mini
thing.
session.
Yeah, mini session.
Is there anything else? Let's see. We're getting towards the end, not too close, but
Oh, I teach seminars.
okay. You teach to other physical therapists, or
I used to teach seminars for personal trainers where I would go to their gyms and do things like that. And I was accredited for that, and I stopped doing that for a while. But teaching personal trainers how important it is to stretch out your clients, to keep your clients. You know, our society is so strengthening driven, the media and everything. Strengthening is going to solve all things, but it actually causes most of the problems. So somebody that wants to get better, they think, okay, I got to go strengthening, but that's the last
piece.
The last piece. It's not the first. So they go to the gym, and their tight muscles, it doesn't take very long to fill up the toxins, and then they're miserable, and then they have to wait a week to let those toxins subside. So those are those like weekend gym people. And I try to explain to my clients how things are different now than they were 20 years ago. When a muscle's tighter, there's less muscle fibers because it's shorter. And if you think of a river running through the muscle, when they were younger, they had this beautiful flowing river of blood going through and oxygen, and it could hold, let's say, a cup of toxins that you got built up in muscle. And how a muscle is builds up toxins is that the muscle doesn't stop contracting. So if you have proper posture and you use your arm like throw a ball, you're only using that muscle for a minute or whatever, and then those toxins get whisked away. But if you have poor posture and now you're holding up your head and the muscle's contracting every single second, or your head would fall off. And so that muscle's building up these mounds of toxins in just even a couple minutes, and then you get the headaches and the neck pain and things like that. So, but this muscle that used to be able to hold a cup of toxins is now this shriveled up creek with boulders in it and holds a teaspoon of toxins before you start feeling miserable. So what we're trying to do is lengthen the muscle to get that river flowing through again and to stop making the muscle contract every single second.
Yes. Okay, that sounds good. Now, let's see. Let me see what time we have. Okay, because I want to be sure to mention that next week we're going to have Shalandra Abbey, who is a Reiki master, speaking. She's been in Hawaii for, I think she said something over 30 years, and teaches, has clients, has patients, but had a program at Wilcox Hospital over in Kapa'a. I believe that, somewhere in Lahui. Anyways, in Kauai. And so she will be talking, she'll be our guest next week. So I'm looking forward to that. But before we end, is there one other thing you would like to be sure that the listeners hear or know about before we sign off?
So I think the most important thing that I hope the takeaway of today is that it's really easy to get rid of muscle pain, but you got to get at the cause, not the symptom. And it's all about lengthening your muscles and lengthening them correctly. And why I started my Stretch Away Muscle Pain was that my stretches are safe for your spine. And a lot of stretches out there are for young kids, not for people that have disc problems. So if you have a disc problem and you bend over at the waist to do a stretch, you're going to end up hurting yourself. So my stretches are safe. So getting your muscle length back, getting proper posture is the most important thing.
And then I have a question I just thought of. I didn't want to avoid asking. Plane rides. Because going from Maui anywhere, you're going to be at least on the plane for 5 hours minimum. What do you suggest people do to prepare for a long flight?
You have to bring, they used to have the little baby pillows on the flights, which they don't have anymore, but those things were perfect to put in the small of your back for the plane ride, because you can't just be slouched in your seat. So putting something in the small of your back, either a little pillow or a blanket or a sweatshirt, something to put behind your back to have proper posture. You have to get up as much as you can during the flight and stretch. I even go on the floor and do the lunge stretch in the aisle between the seats.
People think, what is she
doing? I know,
doing?
but I try to educate people and buy my apps. No, but the second thing is I think it's wearing a neck brace gives you better service and also keeps it muscle warm, and then you're not sleeping crunked with your head.
Well, what about those little neck pillows?
Well, that's what I'm saying. Those things. But the neck brace, you get better service.
Oh.
But I mean, you don't want to be sleeping with your head cranked
to-
over, kind of
right,
stuff.
exactly.
But getting up and moving is the
Is a
most
really-
circulating.
Circulating, getting
Everything
that
is
blood.
circulating.
If you have toxins, getting them out of the way and doing that psoas stress, it sounds like
Yeah.
is the best thing you could do.
Yeah.
Okay. Well, that's great. It's been so nice having you here. You are a native of Colorado?
Well, I grew up in Chicago, not the city, but in Illinois, and then I lived in Colorado for many years before I came to Maui.
And you've been here for quite some time.
At
What's
least-
the name of your physical therapy? How can people get a hold of you?
My business is Mauka Physical Therapy, like the mountain, and I'm up in Kula, Lower Kula, at my home. I'm in the directory. The doctors all know about me, so just think of Mauka like the mountain.
Okay. Great. Thank you so much.
You're
It's
welcome.
been so helpful, I think, and I'm hoping people will look at your apps, buy your apps, because I'm telling you, I think they were one.
They're cheap, $2.99.
Yeah,
You can't
I
go
mean,
wrong.
How can you not reinforce all those stretching? And it gives you really, really good explanation, and not only verbally, but it animates. And that's the thing I think is the key that makes it extremely
And
valuable.
I have everything that we talked about I have little videos about explaining why you want proper posture and how to stretch and why stretching is important and proper stretching and what causes your body to break down. All the things that we talked about today, I have little mini movies in there, so it's very educational.
Very educational. I was so happy that I was able to look at them and be able to talk about them, because I found them to be very, very, very helpful. I think what we're going to do, is there anything you wanted to ask me?
No.
No? Okay. Yeah. So I guess maybe we have time for one more question. And I'd say, what would you say is your main descriptor that makes you different from all the other physical therapists?
My main descriptor is that I really try to get at the cause and not treat the symptom. It's kind of like Dr. Jekyll, the kind of thing. I like to really just kind of zero in and try to see. It's kind of a fun game trying to figure out what exactly is going on with a person.
Well, thank you. Mary, you've been great.
Thank you.
I hope people take to heart and listen and watch and get your app.